welcome. My name is Christina Duzyj Buniak, and I am the Maternal-Fetal Medicine Program Director here at Massachusetts General Hospital in Boston. We are thrilled that you have chosen to click play on this video this morning and are considering our fellowship for your ongoing training. I'm so excited to tell you all of the wonderful things about our fellowship program and what it can bring to you in your ongoing career development, training, and ultimately aspirational goals. Massachusetts General Hospital is an amazing facility, and although I personally am not an MGH lifer, it is very easy for me to see why so many people have chosen their ongoing career development and eventually their career, the entirety of their careers here at Massachusetts General Hospital. The Labor and Delivery Suite at Massachusetts General Hospital has about 3,700 deliveries annually, and our ultrasound units have about 20,000 ultrasounds per year. These types of numbers will give you the breadth and depth of experience that you will need to be the most amazing maternal-fetal medicine specialist that we can help you to be. One of my favorite things about maternal-fetal medicine is that it is really the type of specialty where you can tailor your career to your own design. There's no singular definition of what a maternal-fetal medicine specialist is or is destined to become, and no matter what is your goal, we have the resources here to help you to become that person. Our structure is very similar to many other programs that you will explore and hear about in your process. Our first year is our foundational clinical year. You really have exposure to the breadth of our maternal-fetal medicine antepartum unit, to labor and delivery exposure, to care of women throughout their course of prenatal care, as well as in our ultrasound units and genetics units. We have dedicated rotations for you that specify your time spent in each of these areas, and by the end of your first year, you really have laid a concrete foundation in all aspects of maternal care, obstetric care, and the basics for fetal care. We're thrilled to be able to provide this foundational experience because what it does is allow you to vault into your second year seeking research questions of your own design and type. It helps you to identify the right mentors for you to be able to utilize your second year, which is truly a protected research experience for you to be able to design what you like. Our second year fellows have availed themselves of many different research opportunities, including basic and translational science with world-class mentors at the Vincent Center for Reproductive Biology. They have chosen to do perinatal epidemiology projects. They've chosen to do labor floor randomized control trials even. We have the resources to be able to give you the type of exposure to multiple different research realms and to be able to help guide you towards what of that feels the best for your ongoing career development. Our third year is truly a tailored clinical experience, allowed to help you to develop whatever areas of maternal-fetal medicine feel best, be it advanced techniques in the ultrasound unit with CVS training, be it advanced techniques on labor and delivery, such as cesarean hysterectomy, or be it additional resources with outgoing electives, including the opportunity to learn more about fetal echocardiography. We are so proud of our program and the ability for the people who leave our program to design their careers in the ways that we want. We have trained people who have gone to be basic science reproductive biologists. We have trained people who've gone to be perinatal epidemiologists, and we are so proud that our faculty is incredibly diverse and it offers mentorship in so many different areas of maternal-fetal medicine that will really be of advantage to you. I'm also really proud to say that we truly are friends with our fellows. The well-being within our division has been a hallmark of the department, that we all love being together, we enjoy our time together. We're a group of people who really respect but also rely on each other to have the types of relationships that make it such that when we all give care, we feel a high quality, and when the bad things sometimes happen in our world, which they inevitably do, we support each other too. We're so excited that you are considering Massachusetts General Hospital for your fellowship, and we are happy to be available to answer any questions you may have along the way. You will hear more today from our individual fellows on this video, and we hope that it will give you a good flavor for what it would be like to train here in Boston. Thank you so much for considering us, and we really appreciate your time.
Hi, I'm Molly Siegel. I'm a third-year maternal-fetal medicine fellow here at Mass General, and I've really loved my time here as a fellow. I feel like I've gotten just incredible mentorship in terms of my life experiences and my research experiences in all kinds of different areas of MFM and my clinical interests, and I've just really been grateful for the time that I've spent here. One of the things I love the most about our fellowship is our continuity clinic, which is in Chelsea, one of the community health centers associated with Mass General. And it's a true continuity clinic that you do in your first year of fellowship. You take care of patients for the entirety of their pregnancy. You get to know them so well and their families. You can help with their ultrasounds and their diagnostic procedures. You help with their deliveries, and you do their postpartum care. And you also get a chance to be a consultant for other providers who deliver care in the health centers, which is really a unique opportunity to see a different aspect of MFM than we see at our big academic center at Mass General, where we spend the rest of our time.
My name is Taylor Freret, and I'm the second-year maternal-fetal medicine fellow. I'm currently on my research year. I'm originally from California, but I've been in Boston for the past 14 years, so this is really a place that started to feel like home for me, and where I'm training is no different. I did my residency here, and when I was looking for maternal-fetal medicine fellowship, I felt like I had a really good understanding of the type of people that I would be getting to work with, and even still, they've surpassed all of my expectations. What I really appreciate about the fellowship program here is that I feel like I'm treated like a colleague by all of the attendings. It doesn't feel like a supervisor-supervisee relationship. I really feel like they value my opinion, and likewise, I very much value their opinion as well. We call everyone by their first names. Again, I think that just reinforces the collegial nature of the division, and it's one of the reasons that I really like training with all of the physicians here. One of my favorite things about MGH and why I chose to come here is that there's really no cookie cutter mold for who an MGH MFM is. You can look through all of the profiles of the attendings on the website, and you'll see that everyone has very different interests, both clinically and from a research perspective, whether it's about basic science understanding of infections in pregnancy and the placenta, ranging to running clinical trials and everything in between. I personally have a degree in medical education, and I knew that I wanted to be at a place where that was seen as an asset and not something that would take away or detract from my clinical or research time. And I've really felt here that everyone from the fellowship program director to the division director to the chair really understands and emphasizes that that's an important part of my future and encourages me to use that.
My name is Logan Mauney. I'm the first-year maternal-fetal medicine fellow here. When I was thinking about where I hope to be for fellowship, what stood out to me about this program and this department is that everyone is mission-driven, compassionate, and so accomplished in a huge variety of areas. They are as dedicated to supporting their patients as much as they are dedicated to supporting each other. And I knew that regardless of what flavor of maternal-fetal medicine specialist I hope to be, as a funded researcher, an academic clinician, or an expert in fetal diagnosis, this place has the resources, the faculty, and the support to set me up for success. MGH strikes the balance of clinically rigorous training with high patient acuity in a wide range of pathology that also provides a ton of flexibility and protected time to pursue all kinds of academic interests. So I was actually a resident for 4 years here before I was lucky enough to stay on for fellowship. So I felt like I knew this place pretty well. And I couldn't be more thankful that I was able to spend more time here after getting to know this institution, these amazing faculty. And so I hope you'll discover the same things that I did about this place.